State lawmakers from both parties and chambers are calling for some reforms to the health insurance system. They say that prior authorization, that's the requirement for insurers to approve a medical treatment, has gone too far.
And they're hoping to pass a law this year to try to rein it in. WRAL Capitol Bureau Chief Laura Leslie is here in studio with the very latest on this.
Lena, health insurers say prior authorization helps to reduce waste in the healthcare system and cut costs. But doctors say it comes with its own set of costs. And for some patients, it's about much more than dollars.
Can you say hi?
Amanda Watson has stage 4 metastatic breast cancer. She's been through more than a year of painful and debilitating chemo, radiation, and surgery, all to buy a little more time with her young family.
When you look at the time, I mean, what kind of cost can you put with the time with your children and family when you're being told your days are limited based off your diagnosis?
Instead, she's spending hours each day on the phone, fighting to get insurance approval for the care she needs.
And I could have spent that in a different way that would have been more meaningful to me and my boys.
The problem, doctors say, is prior authorization. It started as a tool for complex medical cases, but doctors say it's now being required for basic needs like scans, tests, even some generic drugs. Most are eventually approved. Still, State Representative Dr. Grant Campbell says it serves no medical purpose.
This is about delaying care. This is about forcing patients and physicians to settle for cheaper, less effective care, or ultimately hoping the patient gives up and pays out of pocket.
Campbell is Watson's former doctor. He and other lawmakers are pushing to pass reforms this year they say will benefit patients. But health insurers say prior authorization is a way to control healthcare costs, and limiting its use could mean higher costs for patients. Meantime, Amanda Watson says the current system has its costs, too.
It makes you question everything about your being. You know, it makes you wonder, am I worth fighting for? Is this fight worth it?
Now, I spoke with the North Carolina Association of Health Plans, which represents insurance companies in the state. Its director, Peter Daniels, said they are willing to work with lawmakers to find solutions to what he called vexing problems. North Carolina has the highest healthcare costs of any state, he said, and we all share the same goals of bringing costs down while improving quality of patient care. That's Peter Daniels.